Now you see, in the beginning we said that RMP of various tissues is different. For neurons, we said it is minus 70 millivolt, and this is only a general consideration. Different neurons have different resting membrane potential. Then for a skeletal muscle, we said it is minus 90 millivolt, and for the cardiac muscle, it varies minus 55 to minus 90 millivolt. So how is that different tissues have a different resting membrane potential? So if we calculate it from Nernst equation, we don't understand that how different tissues have different resting membrane potential. Well, for this to understand, we should know some limitations of Nernst equation. First of all, Nernst equation assumes full permeability for a particular ion. That means it's not that the membrane has a selective permeability for a particular ion. It can increase or decrease the permeability. It's like the ion can freely move across the membrane, and it talks about single ion only, which the membrane is fully permeable to that particular ion. That is why the potential which is developed when we consider Nernst equation, we say that it is equilibrium potential for that particular ion. So here there is some difference between the equilibrium potential for a particular ion and the resting membrane potential. So in a cell, actually permeable only to potassium ions, and that to fully permeable to potassium ions, the equilibrium potential will determine the resting membrane potential. But in actuality, that doesn't happen, because different cells may have different permeability to varied number of ions, right? So we cannot actually use this equation to determine resting membrane potential fully. Rather, it will determine the equilibrium potential for only one particular ion. So for determining resting membrane potential, we use another equation, that is Goldman-Hodgkin-Katz equation, and this is the equation. Now it looks very complicated, isn't it? But you see, it's just an extension of the Nernst equation. You see this part. This is what? This is nothing but the Nernst equation when we are considering single ion. But Goldman-Hodgkin-Katz equation considers two more things. One is the permeability of the ion. So this pK determines permeability of the membrane for potassium ion. So it has added this pK component also, and this permeability is multiplied by the concentration of the ion, right? And then it has added the components of other ions. So permeability of sodium for the ion into concentration of the sodium divided by permeability of sodium into concentration of the sodium ion, and chloride ions are also considered. So in this way, we can use the concentration of different ions plus permeability of the membrane to those ions. So this Goldman-Hodgkin-Katz equation actually tells about the resting membrane potential, considering the permeability of the membrane to ion and also considering various ions. So in Nernst equation, we can realize that if we determine the equilibrium potential, each ion will have its own equilibrium potential, and depending on the permeability, then these ions will contribute to the resting membrane potential, which can be determined by Goldman-Hodgkin-Katz equation. So actually the resting membrane potential is a compromise between various equilibrium potentials, and that is determined by the membrane permeability and the concentration of the ion. And in resting state, actually the potassium usually dominates the Goldman equation. That is why from beginning we were talking about potassium, because in resting state membrane is very less permeable to sodium ions. So that's the reason that why various tissues have a different resting membrane potential. Hopefully you have understood the role of different ions and the permeability of the membrane to those particular ions. So that was all about resting membrane potential, how it is generated, the role of sodium potassium ATPase, and how it can be determined. Thank you. Have a nice day.